Hi, it's Beth Johnson from Umbrella, and today I'm joined with Jeneen Thomsen from the Southampton Hospital Charity, because I'm not sure if any of you have seen my previous post about marketing during a time of crisis, but I had received a letter from the Southampton Hospital Charity about what they're going through. So it kind of made me think, what can I do? What can the people I work with do? And so I reached out to them. Jeneen, thank you for joining.
Yeah, sure. So I'm the current interim director at Southampton Hospital Charity. So as a hospital charity, we raise just under £5 million a year for the hospital. And this is really, as I mentioned before, to enhance the care and service there. So it's really all the added extras. So it's things that the NHS don't have funding to provide now, where we're really seeing, because of the support of our community and everything that we've done previously, actually the impact that we've made over the last 10 years and the way that people are coming together really strongly now to support the people on the front line delivering services in this crisis.
Oh, brilliant.
Obviously, we were aware of the looming crisis and thinking about, well, what can we do now urgently, really quickly, to get the message out that we need support for our NHS staff who's going to be working all the way through this. We set up the fund. We're calling it the Staff Wellbeing Fund. We're looking to raise money to support the frontline staff, but also the staff throughout the hospital, because we can't forget that, you know, the IT guys are working, the estates teams are working, the catering guys, the cleaners, everybody are trying to operate as normal to support them through this time. So what do they need? Okay, well, they need some food, and they're not going to have many breaks. Let's get refreshments to them. Let's ensure that they don't have to come off the wards for too long, that they can just keep supporting themselves.
So when you say off the wards, because obviously there's drinks facilities and catering facilities in hospitals already. So yes. What do you mean by off the ward?
So ordinarily we have a couple of coffee shops. We've got M&S, we've got WH Smith's, we've even got a mini M&S there as well. And there's also quite a big canteen for staff as well. Now, sadly, we've had to shut all of that down, right, because of health and safety prevention. So in terms of the staff actually getting what they need quickly has become even more of a challenge. Although one coffee shop is staying open with kind of shortened hours. This is Costa Coffee, who you're probably aware, they are supporting the NHS staff with free coffee at the moment. But they're very short on staff. And also we've got our feast, I call it our feast, it's our staff restaurant, which is still operating as well. Okay. But that's a real limited service. So what's happening is obviously staff are working around the clock, probably more than what they've ever had to before, and to ensure that they get what they need really quickly, we one of our three kind of key themes of our campaign is around rehydration. So that's making sure that they've got drinks, tea, coffee, soft drinks, real quick kind of healthy type snacks that they might be able to eat as and when they go by. Within the hospital setting themselves, some areas do have staff rooms, so we're able to facilitate all of that. We're calling them wellbeing packs at the moment. So we're able to facilitate getting packs into those staff rooms, but also a lot of areas, I'm sure everyone's experience that they have within hospitals is that there is a station there that we're looking to put refreshments and snacks there too. Yeah.
Well, I know one of the big things that stood out to me around these hydration stations is that because we work with brands, and we know that brands work with lots and lots of sporting events, and it just seemed to me that this might be a really good opportunity for a brand to be able to step in, because I know there's so many behind the scenes that really want to help, but kind of aren't sure, and as well aren't sure how to face the NHS. It's such a huge beast, and right now so many people are trying to make donations and do good and all the rest of it. But so how do you think this is something that brands can help with? And if so, do you think it's something that can be managed in a central way?
So I think from our perspective, as we are a hospital, and we're a hospital charity, we're very, very used to getting things done and getting things done really, really quickly, literally jumping on any opportunity that is provided to us. And certainly the hospital is hugely supportive of that, because as you can appreciate, anything that we can get to help support our staff and patients is something that we really want to prioritise. So in terms of the actual rehydration stations in themselves, we've been talking as well around not just kind of the need, meeting the need now, but using this as an opportunity of leaving a lasting legacy for the hospital, and actually a thank you for the staff for all of the hard work and determination and passion that they're putting in through this really challenging time. And something like a physical rehydration station, which is permanent, sort of whether that be where I've stated before, in the actual hospital department remit, ward, or whether it be within the staff rooms, is certainly something that I know that will be supported or look to be supported in terms of getting that done. But what I like about the idea of having a permanent rehydration station within the hospital, across the hospital, is that legacy piece. It's that kind of long-term, well, thank you for what you're doing right now, you're amazing.
It is a really nice thank you. It is.
Yeah.
I mean, I've heard people say before, like, you know, after this is over, can you not just give nurses and medical staff free tea?
Yeah, exactly. So it's a real nice for now, but actually it's a long term. Oh my goodness, we were really, really valued, we were really appreciated, and we are continued to be valued, which is really, really important. So in terms of brands getting involved in this, I suppose what I will say is that we can immobilise things really, really quickly if the support is there and the support is committed. Because I think that's the thing, is that if it's a kind of, oh, maybe we're not quite sure. Well, actually, if somebody says to us, well, absolutely, we're committed to support you on this, then I can then look to facilitate that within the hospital. And I'm sure other hospital fundraisers will hopefully say, you know, exactly the same thing, because that's what we do as fundraisers generally, you know, jump on any opportunity that's given. In terms of, I suppose, going back a bit, you know, we appreciate that in terms of brand and marketing spend, that it's really, really vital that we do monitor the impact and the legacy that will have. What will be received in terms of the impact. So, you know, what branding can we produce, where will the branding be, how we promote the partnership, where we would put the partnership in terms of like logo, website, social media, and all that kind of thing. So brands are aware of, okay, so right, you're telling me this is what you need, this is how much it's going to cost, and this is what we will receive in response to our donation.
And I think it's really nice to know that that's something that you can pick up and manage for a brand, because as I said, it's you know, they're used to buying media, they're used to sponsorship, and the NHS can seem like a big unknown kind of beast that they've not worked with before. But if you can do more, and if you do think, you know, supporting hospitals with hydration stations so that the nursing and medical teams can have coffees and teas and snacks and things they need close by to them for free, because I know in my office we provide tea and coffee for free, then yes, please do get in touch with Jeneen or myself, and we can open up the conversation. So thanks, Jeneen.
Thank you very much. Thank you.